and we know why you're here. Without further ado, I'd like to welcome Governor Green to the stage, who's going to open us up for this wonderful day. Please join me in welcoming him.
Aloha. It's really good to see friends and family, colleagues. I was thinking about the intro, and I try to remember a time when we said the healthcare dollars were looser and I had more available. It is always a challenge. And I'm grateful to get to come to this conference, see old friends, but also just kind of update you on where our process is and what we're thinking about. I was just speaking to Dr. Champion, to Michael, and we were reflecting on how many people from our team are here today with Jack and so many leaders. And I'm grateful for that. So you can really see what our administration, which is fundamentally focused on health, wellness, trauma reduction, better access to care, that's what we're trying to do at all times. That's what Judy's been a part of. That's what all of you have been a part of for these many years. And we're seeing it play out in ways that you spoke aspirationally about in the past years. And now some of this stuff is absolutely actually happening. I have obviously the intent to move toward the rural healthcare transformation comments and that panel that follows. That was something that is a huge deal for us that we've been aspiring to have available for so long. And so I'm going to dive in and just share where we are. Oh, my bad. There we go. Okay, so the way my team is approaching things, we're 3 years in, we're honored to serve, and we thank you for helping us to serve, is to look, when we look at what people need in our state, and not simply look ever in one silo. When I talk about building a healthy society, it is about our healthcare system, of course. First and foremost, I'm a physician. That's what, I am at my core. That's how I try to govern. But really, a healthy society for us means so much more. And we've talked about this before, but I'm going to dive into it again. To achieve a healthy society is to do something very different than what other states try to do. And this is how we view health in our state. There we go. Okay. As I've shared before and many times, and I will probably reiterate till the end of my days, social health is what we are about. And when we talk about health in our state, we're not just talking about that nurse practitioner or that PA or the social worker or the the physician. We're not talking about the surgeon or the hospital exclusively. We're talking about those people, of course. That is in many ways at the core of what we do when we see someone that we care about in a clinic, in a community health center, in a critical access hospital, in one of our tertiary care facilities. But what I focus on more than that is looking at all the underpinnings of people's health. When I see this first slide, the first thing that pops in my mind is Alice. Not for any special reason. Maybe it's just right in the center of our triangle. You could look to the angles and you could see access to healthcare and you can talk about poverty, but look at that, Alice families. Why is that so important? Well, a whole heck of a lot of our people are living paycheck to paycheck in our state. And that means they don't have enough time to take off to go to their pediatrician's visit with their kids. They don't have necessarily enough resources to get daycare for their children. They are worried about paying their copay for their medication, even if it's small. It is amazing how some people really have to consider $25 copays while they're also thinking about their parents who are in assisted living, while they're also thinking about saving for their 15-year-old. Something very close to me. I am a 55-year-old physician governor, granted, but I am worried about making sure my father, who is in memory care, gets what he needs. And I'm worried about what my 15-year-old, who is a freshman at Iolani, and my daughter, who's 19 in college, what they need, all at the same time. And then I imagine what kind of regular people are facing when they have one job, great job, but they don't have access to every possible phone call and lever. It's real life. And there are a lot of families that live in real life here in Hawaii. Most, in fact. And that's what healthcare is, making sure people have access to resources. And in that triangle, you can also see us talk about housing. And you can see us talk about just innumerable social determinants of health. But I've actually tried to streamline it just to talk about social health. And that is how we're approaching things. Now, our health policy is meant to make us a national leader. And so in our state, we have access to all of the different levers quite quickly, because when we get together, we can do it in one room. We can have the leaders from the Healthcare Association and the Nursing Association, and we can have leaders from each of the hospitals and the plans. But we don't have to do what other states do, which is spend months and months and months trying to find each other. And then when we move forward, we know that we can deal with some of the other crises quite quickly. Even if we've first only begun to scratch the surface of some of these challenges, you can see how it manifests very quickly. Now, we come to the top of the rankings on access all the time. And we are, of course, the beneficiaries of the giants that stood before us. And I will say the people that passed the Prepaid Health Act in 1974, they were thinking about society 50 years later. And that is incredible, because we can cover everybody. But as we know, the system in the world has changed. And I don't know that there's any single entity in the state of Hawaii that can say things are perfectly good. Economically, we are fine. We can do whatever we want. That is why, if I may be blunt, we're hearing the early parts of the discussion about Hawaii Pacific Health coming together potentially with HMSA. They, if I may, are trying to be real about what the challenges they see in the state. I'm not saying it's good, bad, or somewhere in the middle, probably, but it is just very real. And that's why that discussion is happening, even in the state that has the best affordability. Our rates are lowest. We have the best outcomes almost across the board. As I shared, we have the best coverage. We are the health state, but we know that there's still probably 2 steps at least that we could do better. And that's why we constantly are aspiring to do more. Now, this is what things have looked like in the last few, months or years. Like I said, we've had 3 years together. And what we've tried to do is we've tried to actually expand our infrastructure. We've tried to make sure, and I come back to this a lot of the time, maybe because I'm just too dumb to think up new ideas. But I come back to access, and I think that we have a very unique opportunity here in the moment. Wherever that discussion goes with consolidation and partnerships, we really have the opportunity to across the board achieve access for everybody, universal access to healthcare, having providers, having new systems and better technologies right there at the tips of our fingers. The last couple of years, we've expanded Medicaid. We're at 399,000 people, plus or minus right now. If I'm not mistaken, we peaked at 465,000 individuals, just about. And back before the pandemic, probably closer to 2008, 2010, we were down around 252,000. So just think about that. We have 1.4 million people in our state. At one point, we were 250,000, which was 1 in 6. At our peak, we're at 465,000, we were 1 in 3. And that's our universe. That's our universe of needed care for Medicaid. And we've settled right now in at about 399,000 as we face what may come. The work requirements, the federal government putting pressure on all of us to, reassess what we're going to do with our safety net. I know what I'm going to do with our safety net, but I know what they may want to do with our safety net at the same time. And then we had to do certain things to deal with the housing crisis because, again, people are houseless. It's doom. It's total doom. On any given day, we have about 6,000 people that are unsheltered homeless in our state. But the number of people that seek services connected to the homeless health system in the course of a year is 15,000 unique individuals in our state. That's more than 1%. So more than 1 out of every 100 people at some point in our state need extreme help with their health, their housing, just their survivability. And so that's why emergency proclamations came out. That's why we looked at all of these other programs that we've talked about a lot, the Kauhale program. When I stood here before you guys 3 years ago, we had one Kauhale program, a village, a community with services that wrap around. Sometimes great, sometimes medium, but I'll tell you, accessible. We now have 25 Kauhales across the state, 25. We've gone from 1 to 25. And that's what social health looks like in my mind. Again, it's not a perfect system. It will be audited, it will be checked, it will be assessed, but it really is the right thing for us to do from my perspective because it gives us another touch point for people who are struggling the most. That's why you read words like Kauhale program, which is now at about $50 million a year. And I will tell you personally, worth every penny. Worth every penny because if an individual can't get access to any care, if they're unsheltered, we know what that looks like in their life. That looks like visit after visit every month to the emergency department. It looks like chronic disease untreated. It's mental health care not accessed. That's what happens to people. And that's a significant part of our society. And then from that point, we move from the social health over to resilience. And you can see that we have wrestled with a crisis, of course. It's now been over 2 years since the Maui wildfire occurred. And I think we deserve to give a little extra applause to Alika and their team. They have done extraordinary work on Maui, assessing what really happened and what the consequences of isolation and displacement are. You know, on that fire, on the date of that fire, 13,000 people were affected. 13,000 people. 7,996 people within 13 days were placed into some form of housing in hotels. We had 8,000 people ask us to house them. 5,000 were able to find other houses with their relatives, with their friends or family. We housed 8,000 homeless people in 13 days and then spent the better part of a year getting them more stable housing in long-term rentals, in converted short-term rentals, in houses that we could build. It was really the largest homeless initiative that we've ever seen in our state. And what it did was it showed us what you have to do if you want to be resilient after a wildfire, after a catastrophe. We thought it was going to be a hurricane, to be completely honest. It was a hurricane, actually. The hurricane was offshore, and there were 78-mile-per-hour winds that were spiraling, which when the fire occurred, because things were so dry, because there is actually this phenomenon called global warming. I'm sorry to tell the rest of the world that. When there was a fire, there were embers that went up into the air at 78 miles per hour. And then when they went down the mountain, it was just an utter disaster. And we lost 103 people. We did discover another individual that passed not long ago. But we did other things to show that we could be resilient. And what we did was we put together a plan, called it the One Ohana Plan, to immediately care for those families who lost someone. And then what that did is it brought PICO and the healthcare community and the county and the state and everyone together, settled all the cases so that in the next iteration, we could build houses together and people didn't have to sue each other and wait 7, 8, 9, 10 years to begin to put clinics up or to bring in trauma services or to do what we did with all of our harm reduction teams. So we were able to actually create wellness programs and implement them in the moment without conflict, without controversy. That's what resilience after a wildfire looks like. And then we rebuild. And you're seeing rebuilding right now. You'll see 900 houses rebuilt by the end of next year, I believe, by the end of 2027. There were 561 houses that were burned, that were owner-occupied, and another something like 1,700 or 1,800 homes that were rentals. But we will build those permanent houses back first so that the community can come back together and heal. We have to do other things, though. The more focused healthcare needs. What do you do when you can't get providers to work in rural areas? And that's always a challenge for everybody, of course. It's also a challenge in urban centers, I would say. But we put the help program together, the Hawaii Healthcare Education Loan Repayment Program, HELP. We're good on acronyms with our team. And we've already done, I believe, over 900 scholarships, and it's going to continue. It is extraordinary how far you can go with pretty modest means. That program is about $15 million a year. Certainly going to be augmented by the rural healthcare transformation dollars as it builds out training programs, which are essential for us. But this is the way. This is one of the ways, anyway, that we get to a place where there's simply no provider shortages from a functional standpoint. I know we'll be here 5 years from now and we'll still say hard to find a pediatric nephrologist, or it's hard to find a certain subspecialty on Kauai or on Molokai, of course, challenges. But we will be able to get to a functional place where we don't have a shortage if we keep committing ourselves, and you can bet we will. There's the dollars on the reimbursement program, and I would please encourage you, keep hope for all those who apply. We can only do so many scholarships per year, but we will get to everybody over the course of time. It's a very ironic thing. I tell people not to pay their loans off early because in this particular case, you guys should be submitting names of your providers, of the people that are working public health, that touch the clinical side. Anybody that is delivering healthcare in our state is going to find their way to this scholarship if they're young. And I see people all the time, and I'm telling you, it works. Here's our tackling homeless approach. And like I said, housing is healthcare. I say it all the time. I mean it. There's the number on the Kauhale. But just remember, if someone is unsheltered homeless, they lose 30 years of life. The average lifespan in our state is about 81. It's about 51 if you're without a home, if you're consistently going through a chronic homeless cycle. And that is about as bad as any terrible cancer. It's certainly worse than most chronic diseases. And we know what happens to individuals. They live a life of trauma and concern. Their mental illness slips. They have to self-medicate. There's a ton of addiction. But by doing this, just these little villages that we put together, and they're really blossoming, we can give people stable housing. Sometimes it will be for a very long time. In other cases, it's going to be for just a couple of months before they can transition into permanent housing. Everyone's in a different place. That's what we know about people with their health. That's what we know about people with their housing, if they're housing insecure. And I'll tell you that we are really seeing a lot of harm reduction in this population. If you go and walk amongst the people that are in the urban core especially, you'll see a lot fewer people with severe infections. You'll see a lot fewer people that are hurting themselves. I'm not saying it's all gone. I did see a guy smoking ice the other day on my jog at 5 a.m, right on Baratania. It is an unusual thing to see for a governor just out for a walk or a jog, to see someone doing ice or shooting up, which we see, of course, in a lot of the urban centers. But at least people will have a place to do it where they can be safe, or we can find them, we can get them care, and maybe get them into rehabilitation. Maybe we can get them onto medications for their addiction. Maybe we'll figure out another way to use GLP-1 agonists. So here is what I say, obviously, about our housing shortage. Again, it's very tough in Hawaii. And I know we're at a health conference. I know you guys are health leaders. But if we take executive action, everyone will tell you the number one way, the by far best way to deal with the housing shortage and deal with all the crises that come from that is to simply build any manner of housing. Whether it is, and should usually be, affordable housing, deeply affordable housing, but any housing helps a ton, because then people find their way through this whole spectrum of housing. And usually when you build a lot of even housing for affluent individuals, it opens up a lot of inventory that ultimately working class people like all of us end up finding ourselves in. Why do I put this slide on there? Well, again, mostly what I deal with is affordability. And that, of course, touches healthcare, of course, touches Medicaid deeply. But we found that it was just simply too expensive to be in Hawaii for almost every group. Only about 5% of our population was living without any economic concerns in our state. So we went from the second highest tax state to the fourth lowest in just 3 years. And this is an important thing to share, because this is all the individuals that are living somewhere near survival in the state of Hawaii. And if they can save $3,000, $4,000, $5,000, $8,000 per year, that's the difference between them staying insured or not being insured, or being able to go and do what they're supposed to for their children versus having to let a lot of their social challenges drift. And that's where we are today. Now, it has not been totally easy because it's been turbulent with the federal government. They took $3 billion out of Hawaii's economy last year between the tariffs and the shutdown and decreasing tourism. That's a big hit for us. But we were able to weather it because we've been pretty cautious with our money. I'm not trying to be prudish about spending, and we're not cutting any services. But I will say I did do some line item vetoes because I wanted to save for a time when we really need it. And that certainly paid off after the wildfire. You can see the intersection of trauma and healthcare in our state. Obviously, Tia, is Tia here? There's Tia. Tia's been one of our stars, in addition to, all this executive team that you see, like, Michael and Jack. And Tia has been running ahead of the pack with our Office for Wellness and Resiliency. And it came, of course, at the exact perfect timing. Because of the wildfire and because of the crises that people are feeling with things like the shutdown. When we had the shutdown and went and volunteered with the food bank, it was astounding how many people shared that they are upper middle class and couldn't afford food and couldn't afford healthcare. And they were falling right into the category of needing wellness support. Now, fortunately, that faded some after the shutdown ended, but there were thousands and thousands of people that went from here kind of doing okay to crisis. And that's where this is one of our great, as far as I'm concerned, great additions. And so we have special appreciation for the Senate, for Donovan and others who helped, pass that and fund that. But you can see what our trauma impact was, how we kind of look at trauma in our state and how we're actually responding to it. And it's important because not only are we doing it, but other states are looking at Hawaii. They're looking at states that have been 2 or 3 steps ahead of them. First, the Affordable Care Act, kind of got augmented in our state, all building on, of course, the Prepaid Health Act. And then we come to a place where you can actually do these kind of things. And other states are wondering, can they do it too? And that's why it's important that we succeed in Hawaii. A couple comments about this before I wrap up. I don't know if you guys know how this all came about, but they were debating the president's bill, and he was not going to get his votes that he wanted. And I will tell you, not trying to be divisive, but there was some terrible shit in that bill. All right. And they were cutting Medicaid, and they were cutting services, and augmenting tax breaks for corporations all at the same time, kind of a perfect storm of danger for states. And I went and talked to HHS. I went and sat with Oz, sat with Secretary, and said, look, you are going to devastate rural communities if you go forward with all this. And POTUS, as mercurial as he is, I'm now trying to be very nice and, a broad company. I said, the president himself told me he did not want to see just a situation where he's getting burned down for 4 years. And the way to burn it all down in government is to take everyone's healthcare away and to destroy the rural healthcare backbone. And so I said to Oz, better fund rural healthcare. And we sat with a couple other governors and sketched out a kind of a fail-safe plan in case the bill was, just ruining everybody, especially our healthcare system. And that was the early seed, the early kernel of what became the Rural Healthcare Transformation Program. And then within 48 hours of the final passage of that bill, again, many things I'm deeply concerned about. What was first $10 billion and then first $10 billion, then $25 billion became a $50 billion appropriation into rural health, with enough latitude for us to do all the things that I've sat here and shared with you and listened to you and, that we've all been concerned about for all these years. That's what began that process. And special kudos to Dr. Oz, because he set the floor of that bill at $100 million for every state, no matter how big or small. That was a big deal for us. Based on population, we would have received $41 million. Based on the actual rural healthcare transformation, the $100 million floor, and then the addition of the additional $89 million, we ended up at 450% of what would be expected for a state our size. And the same benefit, thank you. It's very, very good for us. And so you can see ultimately what will happen. Now, there's going to be this $50 billion of investment in rural healthcare. It does not offset all of the Medicaid cuts at all. So they should not be weighed against one another like apples to apples at all. But what they do enable us to do is to do the many things that we've wanted on telehealth, on systems work, on training programs, on advanced work that we're talking about with wellness, on our medical respite programs. There's $10 million in our proposal for medical respite, which will pay dividends, of course, as you know, at least it's how I feel, across decades. So that's what's in that bill. You're going to have a whole panel about that, but we were amongst the highest award winners. And what I would say is this. Here we are in 2026, early 2026. We have a few more years to work on this kind of stuff together. What I would hope is that as we look at our system, our healthcare system, how it evolves, and as we look at what may challenge us with Medicaid because they're being rough, even though we have an awesome Medicaid team, so we're good. But every state is going to have real challenges. So when you guys go back to your states, they're going to have the same challenges that we have. Take advantage of this transformation grant. Make sure that we're using it in a way that really positions us to complement whatever may come from the partnerships that are emerging and what may continuously be an advantage with the HELP program. Use all of these resources to take us to that next level. This is why investment is important. You can see that if we actually give people access to care, we won't have long distances. This is actually a picture of a very long distance. This is when Nadine Tensala and I were in Samoa. So the most beautiful kid in Samoa that I ever saw. This child had very, very severe measles. And this is what we're about to see across Hawaii and across the country. We're going to see beautiful kids like this. You see pediatricians in the community trying to make sure that they get care. But maybe we can lead the way as we fight the HHS decisions on occasion. Sometimes we even work with them on nutrition and pesticides and other issues, just so people know I'm not a total bastard. I will do those things, okay? But we will also fight for these children because I think, from my perspective, there is consensus, whether it's the American Academy of Pediatrics or the AMA or the healthcare associations or the many, many Medicaid leaders that we've got. People know. Vaccinate your kids. But this is where we are today. In closing, these are some contacts. I just want to thank you. I want to say mahalo for staying in the fight. I'm encouraged. It's kind of like a throwaway statement. We now have 400 people and blah, blah, blah. It means something. It means something. When we can gather continuously health leaders in our state, when people keep coming to the table, keep fighting for the programs, keep committing their lives to training new people and to doing good public health, it tells me that we're thriving. It tells me that this is still the top priority and it's the right priority. So really, bless you guys for staying in healthcare. Thank you for being so courteous and kind to my team. And I really am excited about the years ahead. Aloha.